day everyone. Today we shall be presenting to you about a topic that is called medication therapy management. Nearly half of the South African population suffer from chronic diseases, which means that they rely on medications to maintain their health, or at least should be relying on medications to maintain their health. Now, being a chronic sufferer means that you as the person have to take the medication on a daily basis for the rest of your life. The use of medications has certain consequences. Some are related to the money and some are related to the health effects. And research has shown that these are not managed in a safe and effective manner. Now, in the past year, or like in every year, it has been seen that there are millions of adverse drug reactions that occur in patients, especially those ones suffering from chronic diseases, which means that now patients have to use more money to treat the health effects that are caused by the adverse drug reactions, and also the ones that they were suffering from before. Despite the avoidable adverse drug reactions and the cost associated with them, it has also been seen that patients who are on persistent medication use do also not receive any kind of monitoring. Now that is where medication therapy management comes in. Now you may be asking yourself, what is medication therapy management? Medication therapy management is defined as a distinct service or group of services that optimize therapeutic outcomes for individual patients. Now, these services are independent of, but may also occur with the provision of medication. These services aims to achieve the safe and effective use of medication, and also help the patient achieve the targeted outcomes. The purposes of medication therapy management are first to optimize the therapeutic outcomes of the patients who are using the medications. Second one is to decrease the likelihood of adverse drug reactions which may occur when patients do take the medications, and also to help the patient understand the need of taking the medication and the importance of adherence. And last but not least, to reduce the overall cost that is associated with the health care.
Medication therapy management consists of 5 core elements, which is the medication therapy review, followed by personal medication record, followed by medication-related action plan, and then an intervention and referral, lastly documentation and follow-up. For the medication therapy review, it is just a review of all medication, including prescription and non-prescription, herbal and other dietary supplements that the patient may be taking. Medication therapy review is a systemic process of collecting patient-specific information, assessing medication therapies to identify any other drug-related problems, developing a prioritized list of medication-related problems, and creating a plan to resolve them. Personal medication record. It is just a personal medication record for a patient. A patient medication, prescription, and non-prescription medication are all recorded in that personal record, and any other herbal or supplements that the patient may be taking, she must also write them down. The medication-related action plan, which is the third step, it is the medication action plan, and it is patient-centered. The patient documents all the problems that she faces when taking each medication. So the patient, for example, would write metformin for diabetes and would write what she feels after taking the medication with the other supplements. And then that she shows it to the pharmacist. It is followed by an intervention and referral. The pharmacist should provide a consultation for the patient. The patient should consult the pharmacist each time, and they should provide the pharmacist with the personal record, and then the pharmacist has to review the personal record to check every side effect and all the products that the patient is taking, together with the with the other supplements. The pharmacist then will review and identify any other drug-related problems and so refer the patient to a physician for resolving them if she finds them. And then lastly, it's a documentation and a follow-up. The MTM services, which is the medicine therapy management services, are documented in a consistent manner, and a follow-up visit is scheduled based on the patient medication-related problems. For example, if the patient there's a drug interaction between the other medication she's taking for another chronic and the other drug interaction that she's also facing for the other chronic, during the consultation, the patient should be referred immediately to the physician to check if they can replace that drug or continue with the drug.
Yeah.
When offering medication therapy management services, there are possible drug problems and drug-related problems identified, which can be gap in care, which means when the patient is only treated for diabetes but has other conditions, maybe such as asthma and heart failure or hypertension. So there are no ACE inhibitors for the hypertension, but she's taking the diabetic medication because hypertension and asthma have not already identified by the doctors. And others are therapeutic duplication, treatment of two drugs in one therapeutic class. Maybe a doctor prescribed for the patient two analgesics, maybe paracetamol and ibuprofen, which are in the same class of analgesics. So the patient end up having duplication of the same medication of the same class. And the other problem is non-adherence, which is mainly chronic medication. Many patients who are on chronic medication face a problem of inadherence and they don't refill their chronic scripts. Opportunity to reduce costs, generic substitution or therapeutic alternative. Maybe the patient doesn't know about the generic alternative, so she always buys the most expensive drug for her conditions, but there are generic substitution that is also identified as a drug problem. And also drug interactions. Maybe the two drugs interact. For a chronic patient, maybe she's got a lot of chronic conditions, so the drugs come across and they interact. So the doctor has to remove the other drug or add another drug that doesn't pose drug interactions. And also severe drug interaction like delayed onset for an antidepressant effect that can be monitored. So other drug interaction cannot be resolved at all because the patient has to take the medication. There's no other choice that she can use. So we also have the pharmacist or the clinical therapeutic group that is involved in that therapeutic plan of that patient will come across with identify all these drug interactions or drug-related problems that the patient has, and they will have a plan and will have to resolve those drug interactions. So the gap in care, which is multiple chronics that are unidentified, can be resolved by manifestation of checking up, so that if the patient has diabetes, also check other conditions such as hypertension and asthma and other conditions. So you run a thorough screening in the patient. Therapeutic duplication can be resolved by removing the other drug, which is in a case of two analgesics, so there's no need of the other analgesics. So you can also prescribe one, so you leave the other one out. In reducing costs, like you as a pharmacist, you advise the patient to use the generics, especially for chronics like lifelong chronic drugs, so that the patient cannot spend more money on drugs only. And also drug interactions can be resolved by removing the other drugs. or else prescribing another drug that is in the same class, but that does not pose those other drug interactions. And then adherence can be also resolved by monitoring the patient each and every time she's coming for the refill or for filling up the scripts. For example, you can issue a person a monthly supply for for all her chronics. So you don't give a 2-month supply or more than 2, so that you can easily monitor the patient if she's taking her medication properly, and also monitor the level, the disease levels and the disease states, so that you can see if the patient is using the other medication for the other chronic or is not using the medication at all. And then for severe drug interactions, you must refer the patient as a pharmacist to other physician or specialists, so that they can manage the problem or try to find another therapeutic plan for the patient. Thank you.
Medication therapy management has multiple benefits for both patient and pharmacist. For consumers, it includes economic benefits due to fewer medications being prescribed and needed. Meaning, as my colleague mentioned, that there will be, if there is a duplication of therapy of medication in the same class being used by the patient, then they will be reduced, meaning that the cost will be reduced too. Also, another benefit is that there's improved health of a patient as a direct result of an integrated plan at each specific issue. Meaning that the pharmacist will deal with this condition that the patient has, trying to give an optimum therapeutic plan for the patient. Another benefit that the consumer will get is that there will be reduced risk of adverse reaction to drug prescribed and potentially hospitalization. In essence, there is an overall improvement to health and well-being of the patient. This simply means that if the pharmacist using his or her professional judgment that there's drug interactions within the prescription that the patient is issued by the doctor, and then there will be drugs being reduced there to avoid those reactions that could happen. Lastly, another benefit is the patient will receive a network of health support. Benefits to the pharmacist include further integration into the health team of patients, doctor and pharmacist, as well as other specialists. Improve relationship with all members of the patient's health team, and improvement in their patient's overall health. Meaning that the pharmacist will be in more depth with the patient's condition, patient's medication, will analyze everything that the patient will analyze everything about the patient that has to be analyzed, including the condition, and explaining to the patient furthermore things that the patient needs to take importantly.